A 4-year-old boy with a life-threatening blood disease is recovering in a Shanghai hospital after getting a transfusion of his baby sister's umbilical cord blood 2 days ago. The 1-month-old girl is the youngest donor of umbilical cord blood in Shanghai. However, doctors say that was plan B for the boy. Our reporter Song Wenjing takes a look.
In an isolation ward at Shanghai Children's Medical Center in Pudong, 4-year-old An appeared to be in a good mood today and flashed a V sign to his mother and younger sister Tongtong. An's parents brought him to Shanghai in August after he developed a fever and poor appetite. Doctors found he had a serious type of aplastic anemia, which means his bone marrow doesn't make enough new blood cells. In order to save him, An's mother decided to store their second child's umbilical cord blood, which doctors say had a 1 in 4 chance of a successful match.
To our delight, a high-resolution blood test showed Tongtong's umbilical cord blood was a complete match for her brother. That gives hope to our entire family.
But that was not the original plan. Doctors had planned to use stem cells from adult match as the main therapy, with Tongtong's umbilical cord blood as backup. But now the baby sister's umbilical cord blood has become the boy's only chance to survive. Doctors say the next 3 weeks will be crucial to see whether the umbilical cord blood transfusion was successful. An had a setback 10 days ago when a match donor from the Chinese marrow donor program declined to donate. And in fact, that's not unusual. A different matched stem cell volunteer here backed out just 3 days before the scheduled surgery. And one woman who volunteered for the Chinese marrow donor program says she faces huge pressure from her family.
They say they don't want a needle to be put in my back. Personally, I want to withdraw in the last minute if my stem cells really match someone. I didn't let my parents know when I volunteered to be a donor.
Before the donation, doctors need to inject mobilization agents to let a donor produce more stem cells. The short-term side effects will be muscle soreness and loss of calcium. But those are easy to solve. What's really worrying people is that some believe that mobilizing agents could bring a higher risk of cancer. Some women fear problems if they want to have a baby.
But Wang says so far there is no evidence showing a direct link between stem cells donation and such problems. Doctors say they're closely tracking donors by giving them regular physical exams, and say they no longer put needles in people's backs, but now use a process called cellular segregation. Song Wenjing, Shanghai Live.